Hello, everyone. I'm here today with Dr. Radfar. Um, Dr. Radfar approached me a few weeks ago regarding programs that he has, and I'm sure some of you have read my writings about my skepticism about certain things in our profession, and one of them is this. Dar, we've talked about this. One of them is I feel passionate about this sleep situation that a lot of people and a lot of consultants talk about, oh, if you want to produce more, you need to get into newer things, and one of them is sleep apnea. And you and I have talked offline that we're both patients, and we know how dangerous this can be, and nobody should be taking it lightly. My whole philosophy on sleep is that you need to make sure it's a very important part of your practice. You can't just take a weekend course and start charging people $3,000-4,000 for a specific appliance the lab is pushing, right? You need to have someone basically guide you into a program. And that's what kind of attracted me to your program. I want you to take a few minutes, introduce yourself, and tell me about your story of how you came about doing this. You are a dentist. Talk to me about it.
First of all, Bob, thank you for all the due diligence you do for anyone that you bring to the group. I think that's the one main reason why I wanted to work with you is because of the fact that you're just so good at screening your speakers and people who you bring. So it's an honor to be able to be given the opportunity to do so. So thank you. I know we have a similar backgrounds with San Francisco sports and the major background that we have that's very similar is how the whole sleep thing got into me in 1983 when my parents and I escaped the country of Iran and left persecution to be able to come to this beautiful country and have that quote unquote American dream. And as we escaped, I was on horseback through the mountains of Iran. And I don't think you know this story in detail. The Kurdish coyotes, they call them, were helping us leave the country. And one of the things when I was holding the stomach or from the back of this gentleman who was guiding us through the mountains, this Kurdish man, he kept looking back at me and telling me, don't fall asleep. Don't fall asleep in the middle of the night going through the mountains. And, I don't look at it as being a traumatic incident that makes me a victim. I look at it as being something as an opportunity to live every day as fruitful as you can. So I didn't fall asleep. I stayed up the whole night and I was aware and I was looking around for snipers that he told me to look for. A lot of crazy things happened that night as we entered Turkey. But fast forward to 2009, I actually fell asleep at the wheel. I was going 40 miles roughly per hour, a block and a half away from my home, and I fell asleep and crashed into a tree. Luckily, it was a tree, not another car or a person walking on the sidewalk in my community here in Calabasas, California. I've been a dentist since 2002. No idea what sleep apnea was. I was getting more tired throughout the day. At the time, I was told that I started to snore. And so I took a sleep study after this accident just to see what was going on. And AHI 11, which most of you, when you take my educational program, if you haven't taken any courses, that's a mild, right in the middle of that mild sleep apnea. And of course, they gave me that machine, the CPAP machine. And like 71% of people out there that try it can't keep it. I tried my darnest. And then in 2010, a few months later, the mouthpiece was put on the map as FDA approved, Medicare approved for treatment for sleep apnea. And I was one of the first ones to make one for myself. And 6 months later, my 2.5-year-old son goes through pediatric ENT surgery because he has sleep apnea. Wow. So I go through the sleep apnea process. My son at 2.5, we made a decision to go through surgery to do sleep apnea, to open up his airway. And just this 1-2 punch just kind of made me really passionate about having people sleep better. It's an emotional thing for energy, with your family, with your loved ones, with work, with working out, with your mental health, that if it can affect, let alone a slew of medical conditions that some of us have heard about with some of these weekend courses. And so starting in 2014, after I've done a couple hundred appliances, I started teaching this stuff. So I've taught over 3,000 dentists across the country and some from other parts of the world on how to incorporate treatment and screening of sleep apnea into their practice. I don't have an appliance that I made myself. I don't get money from anyone who tells me to use this appliance from a certain lab. I'm the real deal. I believe in CPAP 100%. Unfortunately, there's people that can't tolerate that as the first line of defense. So the mouthpiece is our next line of defense. So, through my educational program, that over a course of a year or longer, I'm around, available, and we'll talk about that later. But this is my passion. I still do 30 crowns a month. I still do traditional ortho and Invisalign. I place implants. I'm the dentist. I don't just do sleep now. About 25% of my collections is sleep. So I do at least 15 to 20 appliances a month. I'm very blessed. I get a lot of referrals from the MDs in the area, and that's how I show how to grow your practice through the marketing program that I talk about. So this is a big deal. It's an emotional thing that we do for our patients. I've had husbands and wives come in and hug me and thank me for having them sleep next to each other after a decade of relationship issues. So, I'm really excited to share this information with the group. I have a personal experience from this, starting from the escape from Iran to my car accident to all the stories that I hear, all the trials and tribulations of dentists and hygienists, and the rejection that you get from bringing it up and feeling like, what am I supposed to do? How am I supposed to refer this home sleep study, this, that? So all this I've put together over the last 9 years or so, and taught some courses that I think a lot of people, if they haven't taken it yet, love, and I'm excited to share it with your group.
Yeah, thank you. Yeah, and my whole purpose of talking to you was this, that I want education, right? You are providing education. There's no obligation to sign up with anything, and you're providing it for free in your boot camps, right? And that is the number one thing. And I'm a big fan of people learning and maybe not even trying to do it, just to learn the concept. Try to screen people and refer. This saves lives, right? If you decide to get into this and it interests you, you need a program. You need a program that can guide you to where to go. And I'm sure Dar, you have other organizations that you can refer them to, or to even learn more and more. And it is very important for us to be taken seriously on the subject, right? If we show the physicians who are, in my opinion, preventing dentists to be able to diagnose, we're just screening now, is that they're protecting their turf. And one of the reasons is, yeah, we're basically having people handing out these appliances without proper education, a weekend course at a Holiday Inn, right? So tell me a little about your program. Tell me how someone like me, who I took what is that big organization, AA,
American Academy of Dental Sleep Medicine?
Yes, they had a course in LA. I
Right.
came down there, played some poker, did some studying. I came back, I made a couple, and I'm like, you know what, this is not for me. I can't really follow up these people. I can't really properly give the care I give to my patients, right? So I want to hear what you have and what you're offering to dentists like me.
So that's a brilliant, the pivot that I've made from teaching 3,000 dentists in the past is now it's an educational program. What does that mean? When you take the online webinar courses that I have, like my first boot camp is on January 11th, and you'll have the link for your listeners. When you take these series, and when you come to my live events every couple of months where I do a full day kind of presentation on a turnkey on what to do within your practice, that's not it. It's not over. We're going to have weekly meetings on Zoom afterwards. You get to one-on-one with me. all included kind of thing. You can come to my practice and shadow me before our full day event. So our full day event is a Saturday in Los Angeles. Friday, you can come to my office. I'll show you exactly what I do. Every couple of months, I'll have kind of a get together at my house here in Calabasas, Kardashian world. We get to mastermind and talk about, what are the different things that are working and growing your practice as well, not just the ways we treat and ethically and morally and how we work with the physicians so they don't look at us as a dentist that charge $3,000 to $6,000 per appliance, and how I speak to my physicians in my neighborhood, how I go to their offices and thank them for our mutual patients. And I show all that so that it's not just a take a weekend course that you said, it's a follow through. And the reason why there is so much follow through from my end and from my team, where I give you access to the medical billing company that I help set up. It's not my own company. I just help set them up because I know what we need as dentists to make that part, if you want to do that, seamless, is so you can open your mouth and your heart to your patients and just say what you see with respect to the screening process in their mouth, such as scallop of the tongue, lower anterior wear, farpedo, a cross bite, thumb sucking, anything that can indicate that the patient may have snoring or sleep apnea issues. And you could just stop there and just give them a card to a pulmonary physician in the area. Just like if you don't do impacted wisdom teeth or root canals or place implants, you give a referral in the dental world. You need to at least, it's our obligation. People are suffering. They're embarrassed. My number one patient is a divorced male because his wife was tolerating with earplugs. The wife was sleeping in the other room. Now he's, divorced or she's divorced, and they're trying to be in a relationship again, and they're embarrassed. It's hard for people to socially and emotionally be dealing with this, let alone the comorbidities of high blood pressure, frequent nighttime urination, heart attack, stroke, and now 5 times higher risk of cancer, diabetes, and the list goes on, erectile dysfunction. I mean, these are huge things that make a big difference in people's lives. And if you can help one person every month to help them either get screened, let alone treated, you've had that patient forever. They'll always believe in your heart and in what you recommend. And at the end of the day, yeah, some of us want to make some more money. Let's be real. My educational program is like how to lead with your heart, how to incorporate this without buying all this stuff, no buying equipment. I'm so anti that. Just to be able to start it, do it, and then I help you follow through, and also how to get paid. I mean, there's a lot of things that we have to understand on that department, on chart notes and which medical billing company to use and how your chart notes need to be set up so you don't get rejected by the medical billing company if you choose to go that route. A lot of patients are willing to pay cash for these appliances because they've already had a sleep study, or they've already failed the CPAP, or they know that there's a serious issue. It's not just they're missing number 19 and they could, hopefully you can put a $4,000 plus implant crown abutment in there. I mean, for $4,000, if that's what you choose to charge, they're making a huge change. They're getting a huge change in their life with respect to their sleep pattern and their medical comorbidities. So I think the reason why you and I, Bob, work well together is because you understand my goal is to make sure other people don't crash into a tree. It's to make sure that they are sleeping next to their bed partner and sleeping and having a good relationship, and to lower their dental comorbidities as well, right? We know sleep can affect their grinding patterns, their dry mouth. So there's a lot of things, acid reflux, there's a lot of things that it will help your dentistry. So it's an obligation I know we can't diagnose it. That's not there yet, meaning we can't, give them a sleep study with an equipment and help diagnose it ourselves. It has to be done by a board certified sleep physician, which is so easy to do through my program. But we can screen for it, look in the mouth, tell them what's up, ask them if they're snoring or having sleep issues, and just ask, are you interested in me helping you? And if you are, that the next step is so easy for them to get a home sleep study. And then you're the liaison, you're the messenger. Hey, yeah, good thing you took that study where you have moderate sleep apnea, AHI 21, and I can help you. But board certified sleep physician has recommended you try that mask. oh, there's no way, doc. You know what? Try it at least. You know, worst comes to worst, if you don't like it or tolerate it, I'm here for you to try the next line of defense, which is the oral appliance. And then if they don't have enough teeth or they don't like the CPAP machine, then we can talk about surgical options. So I go over everything, and it can't just happen over a weekend. We get excited, we go back on Monday, we have patient that's upset, you're doing an implant that failed, you know, all these things that we deal with, that I deal with, you need some guidance. So that's why every week I'm going to be on you in a very nice, positive way, keeping you informed of any changes that happen in sleep, and to direct you and have, if you have any questions. I am notorious, Bob. I think when you text me, I'm responding within, like, I don't know, within an hour usually. I'm very big. I don't have like 4,000 messages not read. I'm not that guy. I have everything is clear. No emails are unread. So I'm very on top of my doctors that take my courses, and I'm really excited to follow through with you and guide you through the different parts of this program, so that you can become successful in treating and hopefully gain some financial gain in it as well.
Yeah, and you know, there's a couple of things you mentioned there that it's kind of like there's a little stigma nowadays about making money, but you know, I'm watching, and I used to have it myself, right? Like, oh, I don't want to talk about money, I don't want to do this, but you know, as the Shark Tank people have taught me, you can't help people with your cause if you're not making money.
Right.
If you are not a successful business, you can't help anyone, right? So yes, the system needs to be there. But the most important thing for me personally, and people who are listening to this, is making sure the money part is not your objective, right? You are a doctor. To me, this is an issue we can help our community, right? That guy falling asleep on the behind the wheel could come and kill me, you know.
Or your
So,
family.
yes, and that is, again, I'm a patient. You know, I wear a CPAP. I have two CPAPs because I work here in this room for dig, and I have it here because I fall asleep. I need to put it on before going upstairs. But I want dentists to actually do what you just said. Please make sure you suggest to them to first get a CPAP. That is the gold standard, right? It's like the rubber dam for a root canal, right? It's
Right.
it has to be standard of care that we are recommending them. Hey, go give it a try, because that is the best thing. Now, it was eye-opening for me when you told me about the numbers of people, because I love my CPAP, right? And that's what I always tell people. Oh, go get used to it. Yeah, there's no need for this, but the numbers you tell me are eye-opening. That not a lot of people can tolerate this, right?
Yeah, you know, it's estimated that 71% of people that get their CPAP give it back. They don't tolerate. That's where we step in. You know, a third of our life is spent sleeping. And you've got 8 billion people in the world, and 20% is the lowest number of estimation of people who have sleep apnea. So if you've got 8 billion people, you got 1 point something billion people have sleep apnea. You know, that 1.6 billion, there's a lot of them that are still suffering. You know, 3 to 5 years ago when I was teaching my courses, not a lot of people have had sleep studies yet. Today, a lot of people come in and I go, hey, Bob, so, you know, when had you back, I looked in your mouth and we were doing your, you know, checkup and exam, or when I was doing a crown on your lower right here, I noticed your airway seemed a little bit collapsed when the tongue was falling back and you're awake. I'm concerned when you sleep, if that tongue falls back too far, it may cause snoring and not getting enough air and not get enough oxygen. Have you ever been told that you know, gasp? Have you ever gasped for air? Have you been told that you snore? Like, any problems like that? Oh, no, doc, everything's fine. I do great. Okay. 6 months later, they come back. They're like, hey, remember that you were telling me about that? That last time, my wife tells me I snore. What can I do about that? Remember, you're not going to get the full truth from our patients. But a lot of them now, when I bring it up, they're like, oh yeah, I got a sleep study 2 years ago. I tried that mask. That thing doesn't work. I hate that thing. Okay, well, can I look at the sleep report? Maybe I can help you. Nowadays, I've been able to help patients who can't tolerate their CPAP with an oral appliance. You know what? I've heard about that. Does that thing really work? Yeah, it works for a majority of patients and depends on how high your sleep study, your score is, how severe it is. And that's what I teach in the program. It's you're going to get a lot of like, whoa, this person who's 160 pounds and 5'8" male has sleep apnea and he's already got a sleep study. Yeah, you know, and you can see it in the mouth, you can see it in the medical history, and I teach you guys how to do that. But you also have to be prepared for the patient that says, nope, I already tried it, I don't want it. Okay, are you sure? You know, like you got to still guide them to the first line of the gold standard, and that's ethical, it's legal, it's the right approach, and you're still going to have plenty of patients. If you have 20 hygiene patients coming in a week, which means you have a very like you're only working 2 or 3 days, 4 of those patients are going to have sleep apnea, and one will follow through with doing an appliance. I mean, that means you should be able to do at least one appliance a week. I mean, the numbers that most of my practitioners or dentists that take my courses, they are making, let's talk about the money because it relates to how many appliances they're doing. They're doing about an extra $250,000 a year just by doing sleep. And that means that they're helping so many people that couldn't wear the CPAP. Majority of the patients are CPAP intolerant that you will help. And then there'll be some that have AHI so low that the board certified sleep physician, who I tell you how to become friends with, will automatically send you the patient without even a CPAP trial because the AHI is close to a 5. It's under 10. They're not going to give them a CPAP if it's under 10. They're starting to move that direction that are really mild cases. They won't even try the CPAP. They directly refer it to me. And so it's exciting for us to help all these patients. They're more aware. If you've taken a course in the past, today, a lot of these patients have already gotten a sleep study, especially during COVID, sleeping next to their bed partners more, not traveling as much. They're aware that there's a problem. They're not aware that the buccal cusp on 30 is fractured and they really need to fix that yesterday. This is more of a serious condition for them, and they're excited to hear about something that you have and offer, and that's my program will actually guide you in kind of how to speak to them, how to present it, financial recommendations. My staff is available for your staff to speak to when it comes to things to how to present the financials or scheduling and all these other things. So it's become comprehensive and definitely a good follow through to make sure that those CPAP non-compliance can really also be treated.
You know, one of the issues I had with dental appliances in my practice was that I felt like I wore the dental appliance. It did change my bite, and um, my wife told me, "Oh, you're starting to snore again." So, what does your program do to follow up with these patients and see how effective they are? How is there such thing? And this is I'm asking these questions for my own benefit. Do you have a follow up with patient program?
Yeah, 100%. First of all, they come every 6 months after we dial in the appliance. What does the dial in the appliance mean? Their snoring is almost gone, if not 100% gone. They do feel less tired throughout the day. Their frequent nighttime urination, if it was present, is down from 3 times a night to 1 time. They're dreaming more. They just overall have a better feeling. Boom. We've titrated you 1 millimeter at a time, which of course I show with the appliance. Now I recommend a post-op home sleep study to do to make sure that their AHI has dropped significantly to a level that both myself and their sleep physician are comfortable with. 6 months later, I see them again. Hey, how's your snoring been? Sometimes I do get, hey doc, I gained an extra 5 pounds. It seems like I'm snoring. My wife's telling me I'm humming. I'm singing a tune again. So I advance it another 0.5 millimeter to 1 millimeter, depending on how bad they tell, oh, I'm snoring a lot, to a titrate. Every 6 months, they come in for me to check their appliance, to tighten the screws for the sleep herps, which is the primary appliance that I use. So that's the follow through. And then I recommend every 2 years to get a new sleep study. You know, and these home sleep studies are cheap. Most medical insurances are covering it. We don't make any money off of it as a dentist. You're just using a certain company that are not shysters, that I've vetted for the last 9 years, so I know they're good to my patients. And that's part of the the stuff that I'll go over in the educational program. All I do is I make one signature, and that's my, and then they send the home sleep study to the patient. So we want to make sure the efficacy is there. So I teach, yeah, like, please, if the patient's having some issues, titrate the appliance every 6 months. Sometimes they'll call on their own. They'll be like, hey, I went camping and was using the mouthpiece, and the guys were saying that you still snore. Is that thing even working? Boom, titrate it every week, millimeter at a time, until we get them there. You mentioned something about the bite. Of course, it's a concern as dentists. We don't want to have shifting of teeth and bite and whatnot. That's why I make a morning aligner for patients to wear for 2 to 3 minutes as pretty much standard, so that their bite changes are minimized. Remember, even if there is a millimeter or so of bite change over a course of a 5 to 10 year period, what you're doing for them in the overall picture of things is ginormous and so much so important compared to a little bit of a bite shifting if they're not wearing their morning aligner. Of course, informed consent, which is all the forms that I give you all during their educational program, is important so that the patient is understanding, you're covered, and they understand the risks that they're taking compared to the risks of not wearing anything, and not wearing a CPAP machine is almost a joke, in all honesty. And so there is no restrictions for you to recommend this, or fears that we have sometimes in starting a treatment for a patient, because you've covered all your checks and balances. And that's why what I've basically paid a real deep attention to in the program.
So you said something that kind of interested me, because my appliance had a morning repositioner, which I had to exercise. It gagged me. I didn't like it. You make them an aligner, basically to take them back to where they used to be.
Yeah, it's super easy to make. There's two kinds. One, a lab can make you based on a normal MIP, like regular bite. Another one, you could just make it. It's like a little wafer. You boil and make it in the office, and they just wear that to kind of reposition their jaw and put it back into play for 2 to 3 minutes in the morning. A lot of patients have told, remember, I've treated over, get this, over 2,200 appliances now over the last 14 years. So I hear it all. And a lot of them tell me, well, I just go eat breakfast right away. Like, I literally start chewing on something. And once I chew, I even chew gum for 2 minutes, and just the mastication moves me back into play. And so they don't even use a morning aligner. They just go have breakfast right away. And there's lots of patients that tell me, what are you talking about? My bite feels totally fine in the morning. They have a lot of elasticity in their jaw. So it's not been an issue where I can't wear this appliance anymore, doc. My bite feels way too off in the morning, and I'm too scared. That over the couple thousand appliances I've made, it's not been an issue. That's not what I hear. It's usually like, it just takes me a few nights to get used to having something in my mouth that I've never had before. The night guard patients get used to it very quickly. So many people have tried the over-the-counter ones now. So it's a lot easier for us to deal with the issues, which are very minimal, after we give an appliance.
Right. So I wanted to summarize what we're talking about here is that, first of all, you have these boot camps that are free and provide CE, that you're going to introduce the concept of introducing a program into your practice. In other words, you let them know what it is, how to go about incorporating sleep programs into your practice, and into your regular program is the one that you hold their hand, you show everything, and basically guide them.
Yeah, where they can come into my office and shadow me. They'll come to my full day course that will be included when they join my program. They have access to all the paperwork, all the templates, all the necessary things to get it done now, not 6 months from now, not I want you to start helping these patients now. I want you to go to the UPS down the street, take them bagels, take them the brochure, which you have access to the brochures that I've made, the canvas posters that I have in my office. You could just the company will just put your logo instead of my logo. All of these are included in the program, so that you have the marketing information. Because you can go to FedEx and UPS. By the way, let's talk about it. They have incredible medical insurance. So that these drivers, when I went 86 drivers, 16 of them within a matter of 3 months got an oral appliance from me, because all 16 were complaining how they'd fallen asleep at the wheel driving these trucks. You know how dangerous that is in the community? And that myself, I'm like, I just want to get this done for them. And so all these things, the boot camp will show you, okay, this is what you look for in the mouth. Another boot camp will be like, okay, this is the appliances that you use. Another one is like, okay, this is the home sleep study. This is what it looks like. This is what the AHIs are, the apnea-hypopnea index. So you're going to get all this information, but then you need to put it together, and you need guidance. And that needs to be included in a program so that we can also update you and get everything kind of in order. So there is no resistance by not only yourself, but most importantly, Bob, your staff. Oh, took Dr. Rad seminar course, and he's all gung-ho about saving lives and relationships. Now what do I have to do? You just have to like literally email a couple things to a medical billing company, email a couple forms that are already ready to go. You just have to sign to a home sleep testing company. It's so seamless. You don't need to have your staff learn medical billing if you choose to go that route. I don't believe in that, because your staff is already doing so much. You don't want them to push back on your Superman and Superwoman mentality now. And so that's what the program is so different. I think the people who have ever taken my courses, they come up to me, they're like, wow, this is so amazing. And then I see them a year later. I'm like, how many are you doing? You know what? I had new staff, and they don't really like, supportive. And that's why we need to have a program to follow up, to have the hygienist that's new to come on the Zoom meeting that I can do with them, and to be able to guide them and have any questions. Oh, this patient said this, now what do I do now? To have my cell phone available if you run into. I've FaceTime with doctors, be like, how do I adjust that appliance again? I'm like, okay, put the key in there, turn it from the negative to the positive, do that 8 times on each side. Oh yeah, okay, good. That's what I'm available for. I still practice a couple days a week. The other days is this. This is it. This is the goal for your 7,000 plus members and any other dentists out there. I am your servant to help guide you in being able to help people just get healthy.
Great. Do you have anything else to add at the end?
No, I'm excited, Bob. January 11th is going to be at radseminar.com, radseminar.com. Everything's rad. I'm Dr. Rad. That Dr. Radfar is my name, but some of the kids at the office call me Dr. Rad because they can't say Radfar, and that's become a fun brand name for me, and the products that I have and all that, which I'll go over, that help people sleep too, and it's a fun thing that I'm doing because it's something that I'm super excited about. Starting on January 11th, you guys will be coming on for free and do the boot camp, and more importantly, you'll get CEs. I know that's a check mark that we need, and just come hear me out so that we can get some people healthy and add eventually some revenue to your practice.
Great. Thank you very much for giving us this opportunity to learn. Again, my motto here is the education first, right?
Yep.
We do this so people realize, do I want to do this or do I want to refer? And that's how people should get into this with an open mind. Thank you very much, and hopefully we can do this again.
Thank you, Bob. Appreciate it.